Thank you for the introduction. I am going to show you our first experience of tele-ultrasound using collaboration live. As you know, echocardiography is done every time and everywhere by many colleagues with different levels of expertise in this field. So, in our daily practice, we often need to give feedback about some exams. Our colleague can ask for feedback during the exam or after, but in this case, the patient is no more available if we need to perform our acquisition. So, we will have to redo the exam. This activity is very time-consuming, especially when we have to move outside the department, for example, to go to the operating room or to the intensive care unit. And in reality, we often receive images or video acquired during the exam on our mobile phone. Collaboration Live is very helpful for that. It allows real-time feedback when the patient is still there and provides a secure way to share anonymized data. We have many ways to communicate with Collaboration Live: by text messages, by voice call, by webcam. We can share the screen with the control panel and finally have full remote control access to the ultrasound system. Today, we use Collaboration Live in our daily practice to guide our colleagues in real time and to show how to scan, how to avoid foreshortening, how to improve the alignment of the acquisition, and how to do 3D acquisition, for example. We use it to provide feedback on complex exams and to provide remote training for your colleagues. So we already saw many benefits to use Collaboration Live. We save time, no need to move to another place or no need to redo some exam. We can increase efficiency and consistency of the exam, limit our exposure to COVID patients, for instance, in fact, improving the experience of our team. It leads so to better care. To illustrate this point, we recorded last week 2 use cases with Collaboration Live. The first case shows an internal collaboration between experts and our heart team during cardiac surgery. Using Collaboration Live may save time. We have not to move to the operating room for complex cases. Thanks for the call, Stefan. You are with a patient I have seen yesterday. It's a patient with aortic stenosis and probably something on the mitral valve, but I am not sure. So because it was very difficult to do the echocardiography, the scan was very bad with a very poor echogenicity. So in my mind, there is no problem with the aortic with the mitral valve, but I am not sure. You can probably confirm it's okay. And I have no idea about the mechanism of the aortic stenosis because of the age of the patient. Is probably a bicuspid valve, but I cannot confirm.
Okay. Let's look at the valve. So I'm gonna look at this aortic valve, and it seems to be bicuspid valve. Could you confirm that?
Yes, I see. Very interesting. I have not seen yesterday. It was too much difficult to be sure.
The ascending aorta.
Yes. Not totally normal, but not too much dilated.
Yes, okay. Thank you for that information. I have a strange image in the right atrium. Could you look at that, please? What could it be? Maybe a thrombus?
Can you make some explain acquisition, because it's surprising. It's very mobile. I do not think it's a thrombus. It's perhaps a small myxoma. I am not sure, but the question, I didn't see that yesterday. Of course, it was a transthoracic approach. We have to speak with the surgeon because it's going to need some adding procedure for that.
That's typically the case where showing some images to the cardiologist, really interesting to share in live because it can be game-changing for the patient also. Yeah, maybe for this patient.
So now we are at the end of the surgery. Nice.
So is it?
It's okay.
It seems okay.
Yes. The right atrium is free now. There is nothing to inside. So it's a good result for the patient. It's a good thing to have the extraction of the small tumor.
Thank you very much.
Thank you to you. Goodbye. The new release brings new enhancement to Collaboration Live. Two control status have been added to use Collaboration Live for diagnostic use. One to check the quality of the remote monitor, and one other to check the real-time network connection. With the new release, we can also do measurements remotely on the ultrasound system, and we can now have access to Collaboration Live with another browser like Chrome, Android, and iOS, in addition to Windows.
Innovation and you, Philips.